Hello, everyone, and a very warm welcome to today's session called Youth Voices in Substance Use Disorders Management, Challenges and Opportunities. Thank you for joining us. My name is Juliana Mejia, and I am part of the ISSUP Colombia board. While we're waiting for a few more to join us, I will begin by saying a little about ISSUP. ISSUP, the International Society of Substance Use Professionals, is a membership organization for the global substance use workforce with about 35,000 members worldwide. It is an international network that unites, connects, and shares knowledge across the substance use prevention, harm reduction, treatment, and recovery support workforce. ISSUP's global mission is to make the work of members as impactful, accessible, and effective as possible. They do this by making it easier to discover and share evidence-based knowledge, best practice, training, and networking opportunities. If you've not done so already, please head over to our website, issup.net, where you will find information on how to sign up for free membership. Our website also has a lot of resources and publications for you to enjoy. You can also watch recordings of past webinars and see future events. I'd like to thank the ISSUP staff for providing technical support for this event. Thank you so much. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You will have the opportunity to submit text questions to our presenters by typing your questions into the questions pane of the webinar interface of your screen. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. Just be sure you add the person you are addressing the question, please, or the country that you are addressing the question. Then if you have a question for Uganda, you can say, please, Uganda or Kazakhstan or Colombia. Remember that the recording of the webinar will be made available for you to watch after the event. Today, we journey into the youth voices with members from ISSUP Uganda, Kazakhstan, and Colombia. We are going to discuss today the role of youth in the management of substance use disorders with three brilliant youth representatives and their mentors. They will share their experiences as youth focal points. A very warm welcome to you. It's a great pleasure to have you with us today. Let me introduce first Nadezhda Cherchenko. She's a youth mentor from ISSUP Kazakhstan. She is MD, ISSUP Kazakhstan Coordinator, National Coordinator of Opioid Substitution Therapy, Opioid Overdoses, and New Psychoactive Substances, Republican Scientific and Practical Center of Mental Health, Amalfi, Kazakhstan, representative of the Youth Committee of ISSUP Kazakhstan. Nadezhda and her mentee, Dina Suraganova, the floor is yours.
Thank you, Juliana. So I should share my screen. Okay. Is everything okay?
Yes.
So first of all, I'm glad to be here. Thank you for this amazing opportunity to share our experience as ISSUP national chapter. So we start working as a national chapter since 2021, but before that year, in 2019, in Vienna was International ISSUP conference, and there was signed agreement between ISSUP Global and Republican Center of Mental Health. So this center is the host organization of ISSUP Kazakhstan. A little bit about Kazakhstan. Is a Central Asian country, the largest Central Asian country, and we have about 20 million population. And our center is the largest center for mental health services, mental health care for entire population. We work from last century. So, and we have two main branches in Almaty, where I work, and in Pavlodar, this is the second branch of our center. So when we officially open our national chapter, we conduct some webinar, and we invited the famous representatives from INL. It was William Maglin and Igor Kutsunok from University of San Diego. And of course, it was very interesting, exciting webinar with interesting topics. Our coordinator, Olha Myszakivska, presented the role of ISSUP in Central Asian countries, and two more specific clinical addictological topics from Igor Kutsunok and my colleague, Maria Prilutskaya from Pavlodar. So we have a lot of interesting activities since 2021. This is the list of them. First of all, we conduct joint and local webinars, joint webinars with ISSUP Ukraine, ISSUP Greece, ISSUP Indonesia and other countries. And we provide some Central Asian open lectures on screening, assessment and treatment of substance use disorders, because this is the very important topic for our colleagues, and ISSUP provide us with the opportunity to conduct these webinars. And after every webinar, we have a lot of new members, because they are every time when they join our webinars, of course, they knew a lot about ISSUP, and they wanted to be a part of our society. And in 2022 and 2023, we, me and my colleague Maria also, we finished INA Plus course for facilitators. And we continue this educational course from our colleagues from Almaty and Pavlodar. And Republican Center has a status of provider of UPC and UTC trainings. So we have two very important research and publications in scientific journals, and of course is participation of international conferences. Local webinars, we have a lot of them in English, in Russian, in Kazakh languages. In a plus course, this is our team from many countries. We joined this course in 2022, and the second INA Plus course was in 2023. Very interesting research we provide with ISSUP Ukraine in ISSUP Pakistan. It was cross-country research on substance use and the role of families. This is very important topic, because family has a very strong effect on patient recovery. And the results of our cross-country study was in journal, Addictology journal. You can see the screen of our title, and I'm very proud to be a part of this cross-country research. The latest of our research is cross-country comparison of harmful alcohol consumption, the experience of Greece and Kazakhstan. We decided to provide this research before the ISSUP Global Conference in Greece, and we presented our results as a part of this side events on this international conference. The idea was we use audit, this is WHO test, alcohol use disorders identification test. We provide this test through one online form, and in Kazakhstan it was about 1,080 representatives cases. So we have some results, and I'm very excited to announce that maybe on the beginning of next year, we may provide the webinar and share with you our results of this research. And the most exciting events as a part of ISSUP global family is a participation in international conferences. Me as a representative of Kazakhstan, I was in Abu Dhabi in 2022, and I have a great opportunity to be on training on UPC training for UPC practitioners, family-based prevention interventions. So it was a very interesting continuation of our research, because previous research was about family, and my next step in this was about UPC family training. So this year we met with our colleagues, partners, and friends from ISSUP family in Greece, in Thessaloniki. It was Art of Healing International Conference. So me and my colleagues, we were on different activities. For example, I was on UNODC policymaker on their training, specific training for prevention. And I'm very proud because these international guidelines will be a basis of our national roadmap for prevention. And I have, as a coordinator, opioid substitution therapy, I was poster presentation about my specific team. So, and last but not least in my presentation is the quite reminder about importance of mental health. Every year we celebrate World Mental Health Day on the 10th of October. So I wish all of you strong mental health, good well-being, today, always. So my part of presentation is end, and my colleague Dina will continue. Dina is the leader of our youth committee. And Dina, please, floor is yours.
Yes, thank you, Nadezhda. So let me continue. Now let me introduce myself. So I am a member of Student Scientific Society of Psychiatry and Oncology in our university in Astana. And currently I am the lead of ISSUP Kazakhstan Youth Committee. Let me tell you about why this committee has opened. So we know that in the modern world, substance use is a significant problem that can cause both physical and mental disorders. So, and the availability of substances on the market, the increase in synthetic psychoactive substances, and the low effectiveness of prevention programs pose a serious threat to the health of the nation. So, the creation of the ISSUP Youth Committee plays a fundamental role in solving this problem, especially given the geographical location of Kazakhstan and the proportion of young people among substance users. So the aim is to provide access for young people and adolescents to ethical, evidence-based prevention, harm reduction information, treatment, and support in recovery using substances. This, of course, will help create a healthy society in the future. It doesn't need to seek out and use substances. Therefore, work should be done now, and sharing knowledge and disseminating evidence-based prevention programs among young people. So our key directions will be to use promotion, prevention, treatment, and maintenance. So currently in our country, we have the problem that school administrators usually doubt about students from medical universities, so there are problems with getting permission on lectures, on getting some interactions with students. That is why we need a solution. So our solution was to organizing meetings with school management, get to know each other, and work together. So the key goal is to that prevention in school is aimed at young people at early stage before they develop attitudes or behavior towards substance use. So, and also we have another problem that the teenagers have lack of platforms, and young people need to communicate. So the solution is to organize summer schools or maybe camps with a mandatory component of scientifically based prevention models, creation of social networks, recording some podcasts, or maybe short videos on YouTube channel. So key goal is to unite young people and educate them so they grow up resilient to substance use and can cope even with stressful situations. This summer, we've participated on the first global forum for youth leaders on drug use prevention, where we studied about prevention on early stages. And as a result of this meeting, we won funding to implement a small project for young people in Astana. So now let me tell you about our project a little bit. So the name of the project is Airplane Mode On. The logo is No Distraction, Focus on Destination. So the main goal is to implement the first stage of multi-component program that will provide a wide range of anti-drug education in Astana, Kazakhstan. The project is planned to be a universal form of prevention. So we have 4 main directions of the projects. The first one is opening parenting classes, training at schools for teens, and creating the board game 10 years ahead with role-playing elements, and informing the general public via promoting account ISSUP Yes Committee in Kazakhstan. And the main and the most interesting idea is the game 10 years ahead. So the game has educational purpose, not playability. We knew that it had to be engaged. That is not the main goal. So the board game came to us as an idea that would be easier to introduce and to work with teenagers. So the idea must be highly effective because role-playing elements of the game improve skills as decision-making, problem-solving, communicational skills, and substance resistance skills. And due to entertaining characters and hypothetical scenarios, this would promote empathy among the players, and they will have opportunity to make decisions while they are playing the game. The game format will create positive thinking about drugs, and will save them from drugs usage. Okay. Here on the next slide, you can see the design and the visuals of the game. So it would be done in an ethnical style. And on the next side, we will have such cards and have some problems like red spots and itching have appeared on your body. So what should you do next? Or how to ask for advices from parents. Or some problems like I have my friends that I have fun with. So this is the card that helps teenagers to solve their problems. Like how can they cope with the problems and ask for help. Okay. So concepts of the idea of the board game. So each stage can include an assessment of risk and vulnerability depending on the choices. So if the student made a risky choice within the framework of our topic, this doesn't mean that he has already lost. It means that the student moves on the next stage where he can make a choice again, and so on until he reaches the final stage. The options accordingly should be different there to show that each choice leads to its consequences or goals. I need to say that the game the game is constructed basically on UTC trainings. So, and the deadline of the game is on December. So thank you for your attention. We appreciate your support. That's all.
Thank you, Dina. So I'm very proud of you that we have so amazing youth committee leader. So Juliana, we will switch off our cameras and I stop showing my screen.
Thank you,
Thank you.
Nadezhda, and thank you, Dina, for your presentation. Now let me introduce Barbara Nakijova from ISSUP Uganda. She is the youth mentor. Barbara is a senior social worker and monitoring and evaluation officer working with Uganda Youth Development Link. She is deeply engaged in prevention programs at the community level in the urban slums of Kampala, targeting out-school slum youth. Her interventions are focused on delaying the onset of substance use among slum youth, with the primary goal of creating a safe environment and reducing substance use. Barbara and her mentee, Nasaka Mastula, the floor is yours.
Okay, thank you so much. I'm very excited to be here. My name is Barbara Nachijova. As introduced, I'm a monitoring and evaluation officer. I'm working with the Uganda Youth Development Link, and I'm happy to be associated with the ISSUP Youth Initiative Uganda. And what my colleague Mercy, Mastula, Nasaka, and I will be doing today is sharing with you what we have learned so far implementing the ISSUP Youth Initiative. As you can see, we are part of the ISSUP Uganda chapter, which started in 2019. So we are making almost 6 years now in existence. Okay, I'll start by telling you about what we do as an organization. Oops. Can you see my screen?
Yes, we can see it.
Okay, great. So as an organization, UDEL has been in existence for 30 years now, and our mission is to enhance socioeconomic transformation of disadvantaged young people through skills development to ensure that they can become self-reliant. And some of our key focus areas, as you can see on the left-hand side, we address or we help young people who have been victimized in terms of commercial sexual exploitation, those who have been trafficked. We also handle the aspect of alcohol, drugs, and substance use prevention. And we also support young people who have been victims of child labor, and we use social research to inform our interventions. UDEL is situated within the slum communities, and that really requires us to use a different kind of approach to meet the needs of these young people, as many of them are uneducated. They do not have fundamental skills like literacy. They cannot read, they cannot write, which limits their opportunity, or which limits their access to employment, because they don't have employable skills. And that's where our strategy comes in, which really looks at, first of all, providing them with the psychosocial support component to ensure that we can address the trauma that they have, but then we also look at the socio-economic empowerment aspect that helps them to thrive further in life, because we have seen from experience that many of the young people who become users or who start using substances early and who engage in criminal activity actually have had limited access to employment. So okay, when I say Mercy, Mastula and I, earlier this year, we decided to come up with the ISSUP Youth Initiative. Sorry, I keep losing my slides. Can you still see my screen?
Yes.
Okay, great. So earlier this year, we decided to come up with a youth initiative when we are benchmarking some of the challenges that young people are facing. And as the recent census showed that Uganda highly has a youthful population, whereby over 77% of our country's population of about 45 million Ugandans are youth who are below 25 years, and about 40 close to 45% are below 18 years. And so what this tells us is that we have to really reach out to the young people, because there's an increase in substance use, and many of the users are young people. In the past, in the 1990s, we have seen prevention work. Myself, when I was growing up, we used to have so many sessions like within the classroom, where we were taught poems on the negative, effects of tobacco. And growing up now, when you look at most of the young people who are about the millennials, basically, many of them do not smoke. It's about, research has shown about close to 10% of the population in Uganda, especially the millennials, are smoking. So this really tells us that if we catch the young people early enough, we can be able to protect them, or empower them to make more informed decisions and remain drug-free. So that is why we are saying why youth involvement matters. First of all, they are directly affected by by substance use disorders. We have seen so many of the young people who were introduced to substances because maybe they did not have what to do. Some of them have grown up in homes that are dysfunctional or broken down, and they end up turning to substances to be able to cope. So they are directly affected, meaning they are at a high risk. So we need interventions like the ones I'm going to mention in the next slide to protect them, to help them make the right decision, to find alternative ways of coping. And then young people also bring unique perspectives to prevention. And now we see the outbreak of technology and all of this other stuff, whereby we can carry on forward some of the interventions, evidence-based interventions that Nadia and the previous colleague were talking about, which we learn under the Universal Prevention Curriculum, the INEP Plus, and all these other interventions. If we can put them in a way that young people will find it accessible but also appealing, then we'll have more results. Like, for example, in our youth initiative, we were using WhatsApp platforms, we were using TikTok to send out messages to young people, and the feedback that we've got has really been effective, as my colleague Mercy will share. And then also youth engagement helps us to really enhance our community impact, but also policy relevance. If we engage young people when we are developing some of these policies, then there's a high likelihood that we shall be responding to their needs with these policies, unlike in the past where we had older people coming up with all these policies that young people cannot actually relate to. And in this regard, we had some of our young people send their views on in regards to the narcotics bill that was being put together recently. It was tabled in Parliament, although it has not yet been approved, but young people had a say in that bill. And then yes. Okay, so here are some of the interventions that we did under the ISSUP Uganda Youth Initiative. First and foremost, we started with the planning phase, where we had several meetings between the youth mentor and the ISSUP regional coordinators. We had so many meetings with Radolf, and they were providing a lot of support, which enabled us to come up with a more relevant activities for the young people, but also looking at the evidence-based aspect. And then we had a visit to the drop-in centers within the slum areas where these young people were, and we had talks one-on-one with them. Mercy and I did this, and it was very helpful as we got some of the feedback from the young people telling us that many of them did not know the negative effects of actually using substances. They did not know that when they use substances early, there's a high likelihood that they will get addicted because their brains have not yet formulated. They did not know any of that. So it was a very interesting point of learning for us to really appreciate that some of these actions are happening out of ignorance. And then we participated in one of the side events, which was held in Vienna earlier this year at the CND. Our executive director of UDEL, Dr. Rogers Kasire, and our senior program manager, Mr. Mtawe Rogers, participated in this, and it was a very interesting point for us to actually learn, get around spaces where, policy advocacy is being done on an international level. And then we also participated in the ISSUP regional and executive meetings, where we made our inputs and updated on some of the activities that we were doing to inform the reporting processes, but also help other ISSUP chapters to learn from us. We had community dialogues, and we did a lot of awareness for parents and caregivers, but also the entire community at large, because we saw the need to bridge the gap between the children, the young people, and their parents, because some of the things that we are seeing, some of the push factors is, families, probably parents who cannot parent well, who don't have the skills to be able to raise their children the right way. Sometimes it's lack of that supervision and support for the children, that sometimes they turn to their peers who give them, misleading advice. And then we engaged with coalitions, and we also did capacity building for other young people in terms of connecting them or being a bridge for them to enroll for courses like the UPC core courses and the school program and the environmental course. And then we also submitted a petition to the Rubaga division chairperson. Sorry. Oh yeah, we submitted. Sorry, I keep losing my presentation. Okay, I'm back. Yeah, so we submitted a petition, and this petition was basically to have some of the young people's views included within the decision-making processes, but also addressing some of the issues at the grassroots that young people were seeing that were pushing other young people into using substances. And Mercy will elaborate on that further. And then we conducted school outreach programs where we talked with young people in schools within the mainstream kind of education about the dangers of alcohol, but also teaching them how they can protect other young people. We had comprehensive discussions that were focused on youth alcohol prevention within the overall Kampala division. And then as of right now, we had planned to do the joint projects, where we were supposed to share or have a learning experience with Kazakhstan, and this is happening right now. I'm very excited. And then we also created social media platforms for young people, the WhatsApp platform and the TikTok platform, which have really opened our eyes so much on experiences of young people within the slums. And probably it will be a point that will inform the next interventions that we shall be having. And we drafted an advocacy letter. This we have not yet submitted to the Ministry of Health, but we are yet to do that. And then we also contributed to drafting the rules and the guidelines for implementation of the new narcotics law. So this was, we were projecting at that point in time. So the law has not been passed. So now this is still on hold. And then lastly, we participated in the peer educators trainings, where we have 30 young people who have been trained to give messages to other young people within the communities on a monthly basis. They gather and then they have discussions on substance use. And then the last activity that we did was to do a research, and I believe our colleagues in Kazakhstan also did this because we were supposed to compare our results. But for us, we have already analyzed our findings. We use the audit tool, which is already a tool that has been used by other organizations to understand how much alcohol young people are using, and this helps us to generate interventions that respond to them or to their needs at that point in time. And our findings, first and foremost, we reached out to 50 young people in general, and we collected data from them. After the data collection process, we analyzed the data, and these are our findings briefly. So out of the 50, 68% were female, and then 32% were male. And why? This is because our population here in Uganda, we have more women than the male population. And then the findings also showed that many of these young people had attained at least education up until the secondary school level. And then we also learned that 38% of them were using alcohol more frequently. So this is our target audience, or this is where we needed to target our interventions, the 38%. And then the 62% were using once in a while, monthly or less. So lastly, we also got to learn about that 28% of still this population that we surveyed or interviewed were taking about 6+ units of alcohol less than monthly, which was not really so risky, because at least we see almost close to 70+ something what did not have any heavy drinking. But then we also needed to support these who were using at least less than monthly. And some of our interventions, like I mentioned earlier, we did awareness here, sessions within Kampala in general, and then we had webinars and peer-to-peer learning where we sent out messages still on evidence-based, trying to talk with other actors like civil society, the law enforcement officers, the community members and community leaders, the need for them to use evidence-based interventions to avoid, the wastage of resources on some of the interventions that we know already do not actually work. Okay. And some of our key achievements is that we were able to reach 60 parents and caregivers by giving them the skills to create safer home environments for young people. We launched the TikTok and WhatsApp platforms, which were quite interesting. And 30 young people were also engaged in the peer-to-peer support. And these have really helped to promote healthy lifestyle online. As we know, many of the parents give, young people phones without supervising this time online. We never know what they're actually doing. So it was important for us to create some of these platforms where they can engage with each other, but then being supervised by the youth ISSUP network lead. And then we had 3 monthly meetings, which helped us to improve stakeholder coordination, because we do not get better results if we are working in silos. We get better results when we are coordinating, learning from each other, because if civil society is at a certain level within the community, and then we have the community leaders who are on the ground, if we are working with them, then we get an opportunity to learn in real time the trends, how they are changing, and this gives us an opportunity to target our interventions in the right areas. And then 30 young people were also trained as peer educators, like I mentioned, and these were empowered to lead drug prevention within their communities. They're more like ambassadors. And then lastly, we engaged 46 participants at the CND, which I talked about earlier. Success stories that you'll want to hear from our youth initiative here in Uganda is, first and foremost, we had a parent from one of the parents who participated in these sessions in Kampala. She said that the community dialogues really helped her to understand her role as a parent, and she now feels equipped to protect children from the dangers of drug use, both at home but also online. And that was really very satisfying for me, because if more parents get to know that they need to supervise their children, then there's a high likelihood that we have parents really looking out for ensuring that the environment in general is safe for their children, in terms of, access to drugs, because now there are incidents whereby drugs are being sold within the shops where daily items, that the items we use on a day-to-day, are being sold. So if communities can come together and say, no, this is not acceptable, we don't want this in our communities, we need to protect our children, that is a step in the right direction. And then one of the peer educators also said that being trained as a peer educator changed their perspective, and they're not avoiding they're not just avoiding drugs themselves, but they're actively helping other young people to make better choices, and they're also creating a safer community. I mean, this is already empowerment at its best. And then also what another peer educator said that they knew that they had to take advocacy beyond conversations, but submitting the petition to the mayor was a key step in pushing for the change. They gathered the input from their community, especially from their parents and the young people who wanted stronger policies to prevent drug use in their area. And they said that the petition clearly represents their collective voice, like they're speaking as one and they're demanding safer spaces. So when we speak with a single unified voice, there's a high likelihood that the people in decision, our leaders are actually going to listen than when I speak as an individual. Yes, so I will invite my colleague Mercy to continue with the presentation. Thank you so much for listening to me. Mercy is a former UDEL beneficiary. She's one of the young people that we trained way back, I think around in 2019, and she's so committed to this work that she remained as a youth ambassador, and she has been continuing to support other young people within her community. And I will invite her to introduce herself a little bit further and then continue with the presentation. Thank you so much. Mercy, the floor is yours.
Nasaka, are you there? Okay, you have 5 minutes.
Okay, thank you so much, Barbara, for the presentation. Hope everyone can hear me. Can everyone hear me? All right.
Yes, we can.
Shall we continue?
Yes.
My name is Nasaka Masuna, former beneficiary at UDEL and youth ambassador, peer educator, peer mentor, and networkers lead and the ISSUP initiative Uganda. I'm so glad for this opportunity to be representing my fellow youths on this platform. Yes, we are going to share about what we've been doing in our initiative, and I'm going to start from where Barbara stopped, from the key learnings from the Uganda's initiative. Currently, we've been working with parents, and it has been really a very, very good impact to us in that we've been able to see that we engage the very people who are staying with these young people, actually who are coming, where people are coming from. Let me say parents who are not being engaged and left out in advocacy or in such engagements. Really, it brings a bad influence to the children since the parents are usually ignorant. But the fact that we've been able to work with them has given us a great impact that now the parents are aware, because some of these parents are the users of these drugs and children are using because they're seeing the parents using. So in the case of involving them, we've been seeing an impact that most of them have decided to put away the alcohol, to put away the drugs from home, from exposing them to these young people. And these young people are really giving us the testimony that, you know, it was like this at home, but dad no longer smokes before us. You know, it was like this at home, but mommy no longer takes this before us. So since we got to know that part of the causes of the young people to use the drugs and the alcohol was the exposure at home, and it really brought up curiosity among young people to see how does it feel to take alcohol. And there is this thing of children and young people to feel like maybe they're also something. So most of them were like, if I want to be like that, I have to also take. That's the image that was in their head, that for you to become like a dad or a real dad has to smoke, a real dad has to take alcohol. But because we've engaged the parents, they have been able now to show a good and a clear image of who a real parent has to be. And now they are in position to be the good fathers. Children now have been able to know that no, a good dad is not the one who takes or is not the one who smokes. Therefore, parental engagement has been able to impact our work and give us better results, since these parents are now enhancing or adhering to what we are trying to fight, the substance use among children and young people. And then we are also looking at one of the other things I've learned as a young person and even my fellow youths is that effective digital engagement. As we've been using social media, just as Barbara shared, we've been using social media to see that our campaigns, our advocacy, our messages and information is really going so far, so that we don't stop at reaching out to only young people in Kampala, young people in Rubaga, but we have been able to also reach out to young people in different areas, the rural areas, as they are listening to this information. Because it's not only young people using drugs and alcohol here in Kampala or slum areas, even those guys in school, our young people are out of school, children or young people, but they are also, we are finding out that even those in school are using. So the best way to reach them out has been also social media, since our world is going digital. So we've been able to get in touch with them via our platforms like the WhatsApp, the TikTok, and we know these are some of the platforms young people usually enjoy to use. So with our WhatsApp platform, our young people have been able to put up debates as they discuss about how can we fight drug abuse among young people. They come up with different topics because we've been able to give them a platform to also become creative, to also become innovative with different things they are able to bring on platform. What can they do? What can they say on that matters concerning their wealth and health? So these young people have been able to share as we've been doing the debates on the WhatsApp and the TikTok. We've been sharing those videos, the audios, the poems. They have been written up and they have been sharing them to each other to see that they are reaching out to many people through all means. Remember, most of our young people are not so much into books, the ones we are working with at SUD Uganda, because they're most of them are out of school. But as we do that MDD, it speaks a lot to them because it's too practical. So as they've been sharing these videos, the homemade, the skits, they have been able to communicate to even other young people who are out of school. So we've been able to catch up with those in school and out of school due to this WhatsApp platform. And it has been also good that we've been able to get feedback that is immediate, in that as you put up something, a young person can say another thing immediately without maybe hiding, since it has been a platform basically engaged with young people or involving young people. So that is one of our platforms has been doing, the TikTok and the WhatsApp. It has also helped us to get other people in the same category, doing the same category of what we are also implementing. Since most of the people, we could not reach out to them physically, but at least through the TikTok, we've been able to engage them. Now, like the young people, the peer educators from different organizations have been able to work with us doing this work using the WhatsApp platform. So it has been a better engagement as our way of doing the advocacy and fighting drugs and alcohol substance among young people. So we also learned that collaborations, especially the multi-stakeholder efforts, yield better results. Since we've been able to look out who are these stakeholders when it comes to fighting drugs and alcohol substance use among young people. We sat with the young people and they themselves decided and gave us the stakeholders after sensitizing them, especially our educators. They were able to tell who are these people contributing to drug and substance use among young people and who are these people who can help us to fight this. So they were able to utter out the parents, the young people themselves, the government, different organizations, the police, different NGOs. So these have helped us to also reach them out, and they have been able also to work with us in order to fight drugs and alcohol substance use through doing different things. For example, in our communities, we've been able to look out to different local leaders and inform them about the essence of standing up for young people to protect them from the use of drugs and alcohol substance. As we are doing our advocacy, we've been also informing them to identify these young people in communities and send them to our centers, since it has been an issue that some of them don't have what to do. So we've been able to push them to centers through the use of local leaders, and these young people have been able to come in large numbers, and we are having them at our centers, training them in vocational skills, because we are using local leaders who are referring them to us at our centers. So that's one of the impact of collaboration with different people. So we faced some challenges. We faced some challenges as we are doing our initiative. First of all, resource constraints, whereby we had limited funding and support because our work really requires some money. For example, some young people used to tell us, we need data since we are running social media platform. So sometimes you can find that some are missing out when we have debates, some are missing out when we have discussions. So it has been some kind of challenging thing, but however much we have been able also to catch up with them, since we have been telling them, oh, you can use your friend's phone, you can sit up in a group and then discuss, send up the information in case we have a debate on the WhatsApp in order to minimize the costs. Then we have been having issues of lack of awareness in some communities where there's still a gap, especially in families and some communities deep at individual levels, where some are still having a hard issue of fighting the drugs and the substance use among young people. Some of them are still judging the young people, saying it is their fault, maybe negligence, but really it's about lack of information and awareness. So we overcome this through the community dialogues we do, through the community sensitizations we do, training up educators to reach out to fellow young people. We do parent engagements in our community dialogues to see that we are able at least to reach out that information to them. Then digital media influence, where there is a need for ongoing education on navigating online influences, whereby we need more people to stand up with us, but it is after educating them. And it's really a big number that we need to cover up. Just so you like resources, the funding is still a little bit small. So we are really affected by that we are reaching a limited number. Then what are the opportunities of growth? For growth, we have seen we have so many opportunities ahead of us by expanding our geographical reach and continuing to collaborate with schools. Yeah, being able to work with some schools, admin engagements, health workers, and governments. We can create even more impact. We have been able to engage these people as we reach out to schools, talk to them, engage the government, the local leaders at all levels to see that we are getting the better results we need. Then my personal hope is that I truly believe that if we support youth leadership by the use of peer educators, we will not only see a reduction in substance use, but an entire generation rising to lead healthier, more empowered lives. Yes, we need to see more other young people rising and the continuous generation to come so that they are fighting this thing of drugs and alcohol substance use by use of leaders. Then the bigger picture we have is here that it's not just about our individual efforts. Imagine a world where youth from every region come together to share ideas, support each other, and advocate for policy change. This isn't a dream, it's already happening, and we can do it. We are using young people to advocate through the use of a petition, as we shared earlier, that we've been able to submit it to our Uganda division mayor, and she has already accepted us to stand with us. Therefore, as we are advocating for policy change, we believe that it is from us, it is starting with us. Therefore, one thing we are giving out to the audience is that the invitation to the audience. This is where all of you, yes, I'm ready. I think it's all. We are calling everyone to stand with us in the policy making and change to see that there is a difference in our generation as we are fighting drug, substance use, and alcohol use. Then the final thoughts and stroke next steps. What are we going to do? What are we looking up to? If there is one thing I want you to take away today, it's that you are not just the future, they are the present. And by investing in that leadership, we are building a better world for all of us. Then a call to action, let's continue to support youth in leading prevention, treatment, and recovery efforts. Together we can create a world where substance use is no longer defined and limits their potential, the potential of young people. Then the other thing is we need to expand the peer educator model to other divisions and districts, training more youth leaders to spread drug abuse prevention messages in new communities. As per our program, we were able to only reach out to young people in Uganda division who are trained. as peer educators. So we need to reach out to more other young people and also different districts. Then the other thing is increase the frequency and geographical reach of community dialogues with parents and caregivers to deepen their involvement in drug prevention and expand the support network for at-risk youth. Then the other thing was the collaboration with schools to implement drug prevention education as part of the curriculum, ensuring that more young people receive continuous support and knowledge on healthy lifestyles. Yes, as in Uganda, we were able to get a new curriculum in education, so we are really advocating for this to see that there is something involved in their curriculum as they are being educated in school, to see that there is something containing drug prevention in their studies and areas of education. Then strengthen and expand digital platforms like TikTok and WhatsApp to engage more young people online, offering ongoing peer support, educational resources, and opportunities for meaningful youth participation in advocacy. Yes, this will also help us to reach out to different people, young people, and get all ideas of young people in different areas and communities. At all, it is really strengthened. Then conduct periodic monitoring and evaluation of the trained peer educators, community interventions, and youth advocacy efforts to assess long-term impact and make data-driven adjustments to strategies. This will also help us to see how far we have gone, where have we gone wrong, to put our things together. Yes. So thank you so much. That was our presentation. I would love to hear from you in case there are any questions. Yes, thank you so much.
Okay, thank you, ISSUP Uganda. We are over time, then we are going to do it briefly. I am the mentor of ISSUP Colombia. I am a social worker with a master's degree in anthropology and a PhD candidate in public health. I'm the director of prevention at Corporación Nuevos Rumbos in Colombia. It's my pleasure to introduce Daniela Junco, who is a journalist with background in graphic content, educational podcasts, and corporate videos focused on preventing psychoactive substance use. With experience in implementing prevention programs, she is part of the communications area at Nuevos Rumbos Corporation. Daniela, the floor is yours.
Thank you, Juliana. Welcome to all to this webinar. Okay, can I share my screen, please? Okay, so hello again, everyone. Thank you for attending this webinar. As Juliana said, I'm the youth leader from Colombia, and we want to share with you our project, which is called Generation Without Borders. And also, I want to share with you the awesome experience to be in the Youth Forum in Thessaloniki, Greece, because I learned a lot of youth leaders from around the world and also from trainers and professionals that know a lot of things about prevention of substance use. So our project is the impetus for creating initiatives that can break barriers and unite communities in search of well-being. So now I'm going to share with you the context of our particular population here in Colombia that we have and the population which we are going to work for. So here in Colombia, we have a lot of Venezuelan migrants, almost 3 million, according to official Colombian migration data. Also, the majority of this population are adolescents who live in vulnerable areas where there is consumption and sale of psychoactive substance use, violence, crime, and low adult supervision, because parents have to leave from their homes really early to work, and they arrive later, really late at midnight. So the bond between parents and adolescents results being really affected. So this opens the doors to people that could contribute in a bad way to these adolescents. Also, there's a lack of initiatives towards Venezuelan adolescents here in Colombia. So that's why it's really important. It's actually extremely important to work with this population due to the level of risk probability. So what is our project about? It's a 10-week educational program for 20 migrant Venezuelan adolescents. And we including workshops on the prevention of psychoactive substance use, communications skill, because I'm a journalist and I think communication is really important, not only when we are talking about prevention, also with everything, because communication, being able to communicate in a good way is everything, I think. And also emotional well-being, because mental health is really important nowadays. So we want to increase their knowledge on these topics and enhance their ability to respond to risky situations, and important to become an agent of change in their communities. So at the end, with our guidance, they will create and design action plans in line with the social development strategy for the dissemination of clear standards on psychoactive substance use and mental health, achieving preventing activities in their communities. So now I'm going to share with you the details of the sessions. In the meeting one, we're going to share with them the program presentation about the behavioral issues, specifically the consumption of psychoactive substance in minors, the risks of alcohol consumption in minors, the progression of psychoactive substance use, the vulnerability of youth to substance use, specifically alcohol, and the healthy vision that youth want for their life or for their future. In meeting two, we are going to talk about prevention and social development strategy. They will learn about prevention, what is prevention, the classification of prevention, the risks and protective factors, what they are, their characteristics, where they are found, and how they are related to psychoactive substance use. Also, social development strategy, what is this, their characteristics, and how it is applied to the project that they will be developed, and also the skills to be developed to prevent psychoactive substance use. In meeting three, they will learn about the importance of emotional management and well-being, the differentiation of emotions, feelings, and mood. We call that the emotion of the day. Also, emotional intelligence, emotion traffic light, and emotional mirror, and the techniques for emotional regulation. They will create a personal emotional management plan. In meeting four, they will learn about leaderships and skills, the characteristics of a leader, the types of leaderships, the important skills to be a leader, and the importance of youth leadership in the prevention of psychoactive substance use. And in meeting five, they will learn about project development. What is a project, an initiative, or a strategy, depending on what they want to do. Also, the explanation of the content of the format that be delivered. Also, the considerations when they will present the project, the rubric, and also the workspace for proposal and initial feedback. And finally, the explanation of deliverables. So also, I want to share with you the importance of the types of populations when we are implementing a substance use prevention program. First of all, the identifications of needs. So different groups have different vulnerabilities and risk factors. Understanding the population allows for adapting approach to their specific needs. Also, designing of effective strategies. Prevention strategies must be relevant and appealing to the target group. Understanding their interests, their values, and their context helps create more effective messages and activities. Cultural and social context. cultural and social environments influence attitudes towards substance use. So if we adapt the project to these cultural characteristics, increase the likelihood of acceptance and success. Also, building trust. Knowing the population facilitates the development of trustful relationships, which is essential for youth participation and commitment to the program. Also, impact assessment. By understanding the characteristics of the population, it becomes easier to measure the project's impact and make adjustments as needed. Also, stigma prevention. Understanding and considering the particularities of the population helps address substance use without reinforcing stigma or prejudice, promoting a more inclusive approach. So, in summary, understanding the type of population is fundamental to design and implement a prevention program that will be effective, relevant, and sustainable. So thank you everyone for attending this part of the webinar. Now we will continue, Juliana.
Thank you, Daniela. Okay, just to follow your presentation, I have to say that there are some characteristics that were very important that Daniela had that made the success of the project and is doing the success of the project. And these characteristics are involvement, commitment, and passion. Next, please. The first thing is involvement. Since Daniela has been with us for 3 years, more or less. She's in the communications area because this is her background. She's a journalist. And then she had to be involved in all the projects that we had, that we are carrying out. Then she had the opportunity to work with the communities directly, with our target population. Then she not only conducted interviews and administered surveys and made videos or things like that, but also she was in contact with them, speaking with them, with the young people, with families, with migrants. This is the project that she's working with. And then, next please, it was the commitment. Then after, because it was her job. It was the next, because her job was the involvement in all the activities that we had at Corporación Nuevos Rumbos. But she wanted to commit before in commitment. Please, the previous slide. Previous. Great, thank you. No. And the commitment, and then she was committed with this. Then she wanted to participate in the trainings that we were delivering to the professionals that were implementing the programs. And she said, I want to be part of those programs. I want to do more. I want to do even more than only cover the news of these projects and these programs. And she did it. She received the training as she had. Her background was not about health or social sciences, but she had her possibility to do it because she has a very good communication skills, and then she took part of the implementation of the programs. She delivered pieces of the programs by herself, of course with the support of us, but anyway, she did even more than she was supposed to do because of her passion. And the next slide, please. Okay, the passion for community work made her to work with this migrant project. She had contact with adults, with migrant adults, and a little bit with youngs. But when she had the opportunity to do a project, to create a project as a frame, within the frame of the Global Youth Forum, she immediately thought about this population, and she said, well, I'm doing something with migrants, and I think that they need. We have to address the problems. We have to address drug use and healthy behaviors within this group. And then it was her idea, and we only supported her idea. And the next slide, please. And we only supported the idea, not only myself, but also a team, the Nuevos Rumbos team, the Nuevos Rumbos staff. We provided guidance on how to structure all the program and how to do the sessions. And of course, we are going to be with her. We are going to assist her in the implementation of the project. We hopefully will do it the next semester. It was planned to be this month, but we are at the end of the school year. Then it's difficult to get the population. Then finally, we have the population for the next semester. In that way, this is a win-win. We win because we have a very youth committed in the prevention, and of course Daniela benefits from Nuevos Rumbos of the experience in prevention, because I have to say that it's important that you have leadership on prevention, but anyway that there has been someone behind an organization, a person of a team supporting what they do. This is really, really important. And finally, the next slide. Just the key factors to summarize this support that we have delivered or we have given to Daniela, and it's that Nuevos Rumbos, or the success of this, is that Nuevos Rumbos has supported young people. We always have young people in our staff, and they, of course, they have to do their duties. They have their activities, but it's not a strict one. They can create things. They can take initiatives, and of course, we can support them if it's aligned with the mission and the vision of the organization. And of course, we don't leave them alone. We provide guidance. We accompany and support those youths, as happened with Daniela. Then we hopefully can share the results in the next semester, maybe in the middle of the semester. Yeah, we'll see what could happen. Okay, I think that that's it. Now we're going to have our questions today. And thank you very much to our speakers, all our speakers from ISSUP Uganda, Kazakhstan, and Colombia. We're going to begin answering some questions. We don't have too much time, but we have some questions, especially for ISSUP Uganda, some for ISSUP Kazakhstan, and one or two for ISSUP Colombia. So the first question, I think, is for, okay, it has not been addressed, but we can start with ISSUP Uganda. They have many questions about the design and the tools and instruments that you have used to take data. Then if you want to answer these questions, I will be more than happy. Very shortly, please, because we don't have too much time. Okay, Barbara, they are asking you if, sorry, let me see.
Could you repeat the question, please? It's raining here and I'm having trouble hearing. Could you repeat the question, if that's okay? Juliana, could you repeat the question?
Yes. They are asking how do you define exactly the number of alcohol units, how it's measured, and if I understand correctly, there is heavy drinking and deep drinking.
Okay. Yes. In response to your question, I believe that is relating to the audit tool, the research that we did. Yes. Okay. We do not have specific measurements, but then we ask them, like on each of the bottle, there's a 500 ml bottle, there's a 250 ml bottle. But then in the past, we had a tendency of alcohol being sold in sachets, like small polythene bags, about 10 mils. Yes, am I being heard? Yes, about 10 mils. So that was one of the biggest challenges that we had, whereby young people could be able to move with this. They would be able to work. Like, let me say, someone is going to work, they can put this in their pocket, and then they're sitting on it as they're working. So we do not have a specific measurement to say that this is the amount of like a unit, but we'd ask them in terms of bottles, like how much are you drinking? If you're drinking maybe three times a week, how many bottles and in which measurement and how often are you actually drinking? So I hope that answers the question. So we are looking at, if you're taking a 500 ml bottle, how often are you taking that? And then if you're taking a 250 ml bottle of vodka or alcohol, how much are you taking? But then there was also an incident of local brew. Now that one is not packaged, okay? So we'd ask them how many glasses, and also we'd specify the size of the glass. How many glasses are you taking on a daily basis of that specific local brew? So local brew is the one that is made at home, like homemade brewed alcohol, but then it's not licensed. It's illegal. It's not supposed to be sold because the UNBS has not looked at it to verify whether it's safe for human consumption. I hope that answers the question.
Thank you, Barbara. And a last question is, the population of the female youth, as you presented, is higher than the male youth. Does this demographic proportion reflect a similar proportion of those who use in the youth population? That is, do you have a higher population of females who use drugs?
Okay, that's a very interesting question. When you look at, I wish I could pull this up. Okay, yeah, so when you look at the findings, they actually clearly show you that we have more male respondents.
Can you see, Barbara?
Can you hear me?
Yes, no.
Yes.
I can hear you now.
The findings show us that we have more males using alcohol than females, regardless of the fact that our population, our sample that we used had more females than males. Of course, that really reflects the general population that we have in Uganda as a country, because we have more females than males. That's how it is. But then when it comes to substance use, we saw that more male young people were using than their female counterparts.
We lost you, Barbara. Okay, we can move on while you get. Are you there?
Can you hear me? Can you hear me?
Yes.
Yes. I was saying, am I being heard? Am I being heard? Okay, maybe I'll type in the chat if that's okay. Can I type in the chat?
Okay, thank you, Barbara. Meanwhile, we can continue with Nadezhda. There's a question. It's not addressed to any country, but maybe you can answer this question.
Sure. I saw one question from Simon in South Korea. He had two questions. First of it, policy implication. How can youth voices influence policy changes related to SUD management at local, state, or national level? So from my point of view, I think that, of course, directly, youth voices is hardly ever can influence on our policymakers. But if we can organize maybe some meetings or roundtables with key opinion leaders, with policymakers, and invite youth leaders to have some maybe exchange of their ideas that they can share with these policymakers, and this is the way, one of the possible way to influence on policymaker. And the second question is about impact of technology. How has technology influenced youth engagement and SUD management, particularly in terms of communication and access to resources? So, of course, our young generation, they have their life in 19% affected by technologies, new technologies, and from one side is a good possibility to create some society or friendly with friendly atmosphere and provide some peer-to-peer activities. But from the other hand, sometimes new technology, for example, like bots or some channels for buying substances, can be a cause of negative impact of our young generation. So what about communication and access to resources? Of course, for example, ISSUP has a website with very useful information, and our members of youth committee can use these resources to educate themselves. We started 2 months ago self-led course on UTC and UPC. So, from my opinion, new technologies can help for young generation to improve their knowledge. Maybe you, Juliana, has other opinion.
I agree, Nadezhda. Thank you. And our last question is for Daniela. Could you answer the question, please?
Sure. Could you repeat the question, please?
Yes. If you have any expectation about your project receiving support from the government offices in charge of migration?
Well, of course, we would like that we have the support of the government, because as I told in the presentation, we have a specific context related with Venezuelan migrants, and specifically Venezuelan migrant adolescents. So hopefully we have the support of the Colombian government, and not only the government, also other organizations, other NGOs that wants to be part of this process, because actually I think it's a long process, because we are trying to focus on this population that have some specific necessities. So I hope maybe after we implement the project, we receive support of not only the government, also other organizations.
Thank you, Daniela. Okay, I think that we don't have more time. Maybe for one more question. And how do you get funding for the activities for ISSUP Uganda?
Okay. Thank you, Juliana. Can you hear me?
Yes, we can hear you.
Okay. Yes, that's great. So usually we don't have a specific budget that, you know.
Ay, Dios. No, y además, preciso le hicieron un poco de preguntas a la que...
Sorry, can I proceed?
Continue, please?
Okay. We don't have a specific budget that is tagged to the ISSUP Youth Initiative. However, we have specific strategic areas, like I mentioned in my presentation when I was starting. So the aspect of alcohol and substance use prevention is one of our key strategic areas. So we have other projects that are tagged to that usually we tap into to co-fund some of these activities. And then we also apply to some of the different funding that is available. Like, for example, the UNODC has supported our work with small grants. And then we've also had grants from Colombo Plan. Like sometimes there's a budget that is specifically available for these youth activities. But then in cases where it's not available, because we know how relevant this work is to contribute to our achievement of our goals as an organization, then we tap into other projects to co-fund some of these activities. And then other times, like now when you look at the community dialogues, we don't fund everything entirely. We partner with the community members. Like now the law enforcement officers, sometimes they have a budget, and then the some faith-based organizations, they really do support some of these activities that we do in the community. So it's an ongoing process for fundraising. It's not a one-off, but then we also leverage so much the resources that exist within our partners and within the community in general. I hope that answers your question. Yes.
Thank you, Barbara. Thank you again to Nadezhda, Dina, Barbara, and Nasaka, Daniela, also for answering those questions and for their great presentations. It was a pleasure to have you with us today. This concludes the webinar. Thank you all for attending. We hope you learned something new and enjoyed the presentations. Just remember that you'll receive a follow-up email in 2 or 4 days with a link to view a recording of today's webinar. We always appreciate your feedback and suggestions. Please use the link in the follow-up email to fill out the feedback survey. On behalf of ISSUP and our presenters, thank you for joining us today and have a great rest of your day.
Thank you.